Hello, everyone. I'm Professor Kanazaire Clementine. I'm teaching at University of Rwanda, and I'm pleased to present the findings from a study I conducted with my colleague. This study was an assessment of common mental disorders and associated factors among healthcare students in Rwanda. University student mental health need and associated factors are unknown in Rwanda. However, considering the high prevalence of mental health issues among Rwandan youth and the country's history of trauma, it's probably that university students are at risk of experiencing psychological distress and mental disorders. Over the past 5 years, there has been a growing number of reported cases of students facing mental health challenges in the University of Rwanda. Furthermore, there is a lack of a well-structured university counseling services and mental health support available to those students. Those unmet needs are likely to affect students' academic performance, impact their mental and physical well-being, and impair their future professional life. This proposed cross-sectional study aimed to address this gap by examining the prevalence of common mental disorders among healthcare professional students, identifying associated factors, and understanding the healthcare seeking behavior. The early detection of mental health problems in this at-risk population would lead to proper follow-up and better outcomes. The resulting benefit of this research would be educating healthcare students who are mentally healthy to support the healthcare system in Rwanda, which heavily relies on them. The research process began with the acquisition of necessary equipment for conducting the study, and subsequently a research protocol was developed to obtain ethical clearance. Following this, a training session was organized and the quantitative research tools were piloted before initiating data collection. The data collection phase involved gathering information from students enrolled in the College of Medicine and Health Sciences across campuses in Huye, Remera, and Rwamagana. The most prevalent mental disorder were post-traumatic stress disorders, followed by depression and alcohol abuse and anxiety disorder. In contrast, suicidal ideation, drug diagnosis, and mood disorder with psychotic features were among the least reported conditions. Comorbidity of PTSD, depression, and alcohol use were also observed. The findings from a logistic regression analysis revealed that female had a significantly higher risk than male for developing PTSD and depression. Age also played a role, with individuals older than 20 years showing increased risk of PTSD symptoms. Notably, there was a significant interaction of age and gender on the symptom of PTSD. Additionally, this study assessed also the awareness of mental health services and use of those services among the university students, and findings showed that 90.8% of participants were aware of mental health services, with 20.7% reporting use of those services for various reasons, including seeking information, seeking help for themselves or for another person. Despite the high prevalence of mental disorders among undergraduate students, the study underscored the importance of considering the lifespan distribution of PTSD in the development of prevention and intervention strategies for mental health conditions. The grant team member participated in writing manuscript, and the manuscript has been submitted to the scientific journal for publication. Thank you for your kind attention, and I hope I raised the issue of mental health among the youth, and I think after the publication, also I will make a policy brief for the leaders of university in order to reinforce the service of student welfare.